Assalamu alaikum. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, Faisalabad. I will discuss about the water. It is the most abundant single constituent of the body. Water forms 75% of total body mass in a newborn, 60% in a lean adult male, and 50% in an adult female. In obese people, the water contents of the body is about 10% less. It is the medium in which body solutes are dissolved and most of the metabolic reactions take place. The body water is divided into intracellular and extracellular components. Sources of body water during drinking water and beverage, water in food, tissue oxidations. Each 1000 calories produced in the body from the oxidation of foodstuffs results in the production of 100 to 140 ml of water. Loss of body water. Urinary excretion is about 800 to 2000 ml per day with a normal intake of 22 liters of water per day. Pulmonary loss through breathing is about 400 ml per day. Fecal excretion is about 50 to 200 ml per day. Water loss through sweating is about 10 to 14 liters per day. Sweat contains sodium chloride which may also be lost during excessive sweating. Insensible water loss from the skin even when not sweating is about 400 ml per day. Other possible routes are tears and milk. Vomiting and diarrheal illness result in loss of appreciable amount of body water which may cause dehydration. Regulation of water balance. Water is regulated mainly by two mechanisms, thirst and antidiuretic hormones. Thirst center is situated in the hypothalamus which produces a desire to drink water. This center is stimulated by hypertonicity of the extracellular fluid and by hypovolemia as occurs in dehydration. Thirst is due to drying and shrinkage of cells in mouth and throat by the hypertonicity of body fluids. Hypovolemia causes decreased renal blood flow which in turn causes release of renin from the kidney. Renin causes the formation of angiotensin II. Both hypovolemia and angiotensin II stimulates the release of ADH from the posterior pituitary which causes increased reabsorption of water from renal tubules. Summary: loss of body water, hemoconcentrations, increases thirst and releases ADH. Thirst, increased water intake, plasma tonicity restored. Release of ADH increases reabsorption of water from the renal tubules, plasma tonicity restored. Excess water intake, hemodilution, decreased thirst and inhibits ADH secretion. Inhibition of thirst, less water intake, plasma tonicity restored. Inhibition of ADH secretion, decreased reabsorption resulting greater loss of water from renal tubules, plasma tonicity restored. Water deprivation. It happens when water loss from the body is not replaced from outside. Water found inside the body is too less to compensate the loss. The plasma becomes hypertonic due to a decrease in volume. The intestinal fluid enters the plasma to compensate the loss. The volume of the interstitial fluid decreases and thus it becomes hypertonic. To compensate the interstitial hypertonicity, the intercellular fluid comes out in the interstitial compartments, producing intracellular dehydration and also the hypertonicity of intercellular fluid. The intracellular dehydration produces the sensation of thirst. If the water loss is not compensated by ample intake of water, more severe changes take place, such as cellular proteins undergo breakdown and potassium ions are released in the cells. The potassium ions leave the cell and enter the interstitial fluid and then are rapidly excreted by the kidney. To balance the ionic loss of intercellular potassium, sodium ions enter the cells, thus disturbing the ionic balance and cell functions. The clinical picture will be dry tongue, collapsed circulations, and renal failure. If water loss is still not replaced, the condition of the individuals becomes worse and death may occur when 20% of body water is lost. Water intoxication. It is the reverse of water deprivations. It is a condition in which water content of the body is increased without a proportional increase in electrolytes. It happens in the following conditions: intravenous administrations of glucose solution, SIADH, syndrome of inappropriate secretion of ADH. Inappropriate excess of ADH causes more water to be reabsorbed from the renal tubules and causes overload. Symptoms are nausea, headache, incoordination of movement, and muscle cramps. Electrolytes. These include sodium, potassium, magnesium, and chloride. Functions. Electrolyte maintains osmotic pressure of the body fluid. Maintain optimal ionic balance between for tissue activities. Participates in the pH regulation of body fluids. Regulate the neuromuscular activity. Thank you very much.